Thank you very much, and welcome to my first virtual panel. It's great to be here. We're going to be talking about immune system, and I just want to take a moment because, as you know, Chanchal and I both have been kind of practicing herbal medicine since the 80s. And Kitty's a little bit younger, and she's been practicing for a little less time, and yet she's, been able to apply what she's learned in her clinical practice as Chanchal and I have. And one of the things that I wanted to just draw to everyone's attention is that what we learned about the immune system in the 1980s is very different what you might have learned in the 1990s or the 2000s or even in the last 5 to 10 years. And the impact of that really has changed and streamlined and morphed what we do with herbs and how we apply herbs, and we understand them so much better as far as their mechanisms, their cellular impacts, their impacts within different aspects of the immune system.
When we think about autoimmune conditions, that is a really important consideration for any time we come across somebody for the first time. And, perhaps if we're treating somebody and they're not responding the way we think, sometimes we have to do that. We have to go back and reconsider the case. Did we miss something? Was there something kind of brewing underneath that we missed in the first place? And sometimes that is an autoimmune condition.
So what I would like to talk a little bit about today is, one of the things that I find myself in clinic and as an instructor in herbal medicine schools that I find I want a lot is to have some kind of logic to my strategy. So when I'm approaching a patient with an immune disorder, and of course, we know immunity underlies almost everything we see in clinic to some degree. I don't want to just throw a bunch of herbs I've read about that do something in the immune system and throw them at the patient and hope something sticks. I want to have a logical strategy.
I love the fact that you brought up logic, Chanchal, because I think that finding a logical sense or in your own mind, and so your logical approach versus Key's versus mine versus many clinicians may be somewhat different, but it gives us a path to start with, and it helps us to really get through some of that kind of barrage of information, and as clinicians, our mind is going in a million different places about all the things that we might do. And so I think it's great for us to remember that we may differ, but we have similar goals and thoughts about the types of things that contribute to immune degradation and autoimmune disease, cancer, and the multiple other kinds of chronic diseases that plague our immune system.